Hello and welcome to our webinar on community empowerment. My name is Jim Phillips. I'd like to also introduce Jenny Hartnell, who's a service lead for Health Connectors Mendip, Nikolai Holm-Faber, who's Chief Advisor, Danish Centre for Health Education, and also Professor Anne Rogers, Professor of Medical Sociology at Southampton University, along with her colleague Liz James, senior researcher. And when we talk about empowerment, what we're talking about here is a real shift about people becoming active partners in the healthcare and community based on what's important to them rather than what is a problem or what's the matter with you. It's quite a fine line when we look at sort of issues such as community empowerment and how the state gets involved, and to what extent too much state aid can create a sense of dependency and a dependency culture. In England, we talk about sort of the benefit culture and other sort of slightly derogative terms. No state aid whatsoever obviously leads to sort of issues such as social deprivation and health inequalities and this sort of thing. So empowerment is trying to get a balance between those two things, and community empowerment is really looking at how do we engage citizens, how do we really empower citizens to get involved in what's important to them, what's important to their community, and how through that we can improve health and well-being, improve our open spaces, and improve the communities in which we live as well. Over the course of this webinar, we're going to be we will hear from Nikolai, and we will hear around the work we're doing in Denmark, across the whole of Denmark. Jenny will talk about the work we're doing in Frome and Mendip, and then we'll hear about a couple of specific tools. We'll hear about the Genie tool, which looks at how we can use tools to improve social connections, but also hear around how do we measure this? How do we know we're actually making a difference? Estimates put that the contribution to health and well-being is only about between 10, 20, 30% is the sort of range is estimated in terms of to what extent clinical care contributes to our health outcomes. The rest of it, 40% social and economic factors, the way we behave, the way we're supported in our community, and also our physical environment. So our community environment is absolutely fundamental to our health and well-being as well. And not only that, in terms of social connectedness, what we see is from a lovely bit of research showed that there's a 50% increased likelihood of survival from health episodes for participants with stronger social relationships. So the stronger our social relationships, the more likely we are to be healthy and the more likely we are to have improved health and well-being. So these are some quite fundamental issues which are now being picked up by health and care sectors across Europe and recognizing this. And now I'd like to hand over and hear a little bit more about what's going on elsewhere.